Hello, everyone. Bonjour à toutes et à tous.
Hello, everyone.
As usual, I'll start with an update on the number of COVID-19 cases in Canada. There are now 17,063 cases, including 345 deaths. On the lab front, we have now completed testing for over 346,000 people in Canada. Of these, 5% are confirmed as positive. So we are able to track where the spread is occurring. Our greatest worry continues to be the numerous outbreaks in high-risk settings where there is rapid spread of COVID-19, as well as severe outcomes in vulnerable people. These settings include long-term care, hospital, and correctional facilities, but also an increasing number of First Nations and at least one Inuit community. A single case in any First Nations, Inuit, or Métis communities is high cause for concern. These communities are among the most vulnerable to COVID-19 due to distances, access to necessary resources, and underlying health conditions. In response to the heightened risk, I'm heartened to hear of the additional steps that leaders of these communities are taking to protect their populations, and we need to all do everything we can to slow the spread of this epidemic and protect all vulnerable Canadians. We've talked a lot about masks over the last few days, and I want to just make a few very important points regarding mask use. D'entrée de jeu, je répète que les
I
masques
want
médicaux
to start by saying that medical masks are in short supply all over the world, and they must be conserved for healthcare workers and other people providing direct care to a COVID-19 patient. Wearing a non-medical mask or a facial covering can be an additional layer to protect and not infect others, even if you are not currently symptomatic. This can help reduce the spread of respiratory droplets to others when you can't maintain a physical distance of 2 meters from others, such as while you're on public transit or getting groceries. However, wearing a face covering does not preclude the need for frequent hand hygiene and physical distancing. Without frequent hand washing and physical distancing, you cannot consider yourself protected against COVID-19.
Medical masks are in short supply worldwide, and they must be conserved for healthcare workers and others providing direct care to a COVID-19 patient. Wearing a non-medical mask or facial covering can be an additional layer to protect and not infect others, even if you're not currently symptomatic. This can help reduce spread of respiratory droplets to others when you can't maintain a 2-meter physical distance, such as while you're on public transit or getting groceries. However, wearing a face covering does not preclude the need for frequent hand hygiene and physical distancing. Without these, you cannot consider yourself protected against COVID-19. But face coverings are not appropriate for everyone or for all ages. In particular, face coverings could present a suffocation risk to babies and children under the age of 2, anyone who has difficulties breathing, and others who are unable to remove the mask by themselves. So thank you.